Question 1. Which of the following is the most common cause of dilated cardiomyopathy? A. Hypertension. B. Viral myocarditis. C. Amyloidosis. D. Aortic stenosis. Answer: B. Viral myocarditis. Explanation: dilated cardiomyopathy is a condition characterized by the enlargement of the left ventricle and impaired contractile function. While various factors can contribute to this condition, viral myocarditis is the most common cause. It often results from viral infections of the heart, leading to inflammation and subsequent cardiac dysfunction. Question 2. A 55-year-old male presents with sudden onset chest pain radiating to his left arm, diaphoresis, and dyspnea. An ECG shows ST segment elevation in leads 2, 3, and AVF. What is the most likely diagnosis? A. Stable angina. B. Unstable angina. C. Non-ST elevation myocardial infarction, NSTEMI. D. ST segment elevation myocardial infarction, STEMI. Answer: D. ST segment elevation myocardial infarction, STEMI. Explanation: the clinical presentation described, along with ST segment elevation on the ECG in multiple contiguous leads 2, 3, and AVF, is highly suggestive of a STEMI. This indicates an acute occlusion of a coronary artery, leading to myocardial infarction and requiring immediate intervention, such as percutaneous coronary intervention, PCI, or thrombolytic therapy. Question 3. Which of the following medications is a direct thrombin inhibitor used for the prevention of stroke and systemic embolism in patients with non-valvular atrial fibrillation? A. Warfarin. B. Aspirin. C. Dabigatran. D. Clopidogrel. Answer: C. Dabigatran. Explanation: dabigatran is a direct thrombin inhibitor used as an anticoagulant for patients with non-valvular atrial fibrillation to prevent stroke and systemic embolism. Unlike warfarin, it does not require frequent monitoring of INR, international normalized ratio, levels. Question 4. Which of the following congenital heart defects results in cyanosis that worsens with crying and improves with squatting? A. Atrial septal defect, ASD. B. Ventricular septal defect, VSD. C. Tetralogy of Fallot. D. Patent ductus arteriosus, PDA. Answer: C. Tetralogy of Fallot. Explanation: tetralogy of Fallot is a congenital heart defect characterized by 4 specific abnormalities. One of its hallmark features is cyanosis, which worsens with crying or exertion and improves with squatting. This phenomenon is known as TET spell, and is due to the dynamic changes in blood flow through the right ventricular outflow tract. Question 5. A 45-year-old smoker presents with intermittent claudication, and a Doppler ultrasound shows reduced blood flow to the lower extremities. Which of the following vessels is most commonly affected by this condition? A. Common femoral artery. B. Superficial femoral artery. C. Popliteal artery. D. Tibial artery. Answer: B. Superficial femoral artery. Explanation: intermittent claudication is a symptom of peripheral arterial disease, PAD, which commonly affects the superficial femoral artery. This artery is frequently involved due to atherosclerotic plaque formation, leading to reduced blood flow to the lower extremities and resulting in muscle pain during walking, claudication. Question 6. A patient with known coronary artery disease is being managed with medication. Which of the following drugs is a cornerstone of secondary prevention for reducing the risk of cardiovascular events in this patient population? A. Aspirin. B. Nitroglycerin. C. Metoprolol. D. Furosemide. Answer: A. Aspirin. Explanation: aspirin is a cornerstone of secondary prevention in patients with coronary artery disease. It reduces the risk of cardiovascular events by inhibiting platelet aggregation and thrombus formation. Question 7. A 65-year-old hypertensive patient with diabetes presents with chronic kidney disease, CKD. Which class of antihypertensive medications is most beneficial in slowing the progression of CKD in this patient? A. Calcium channel blockers. B. ACE inhibitors. C. Beta blockers. D. Alpha blockers. Answer B. ACE inhibitors. Explanation: ACE inhibitors are particularly beneficial in patients with hypertension, diabetes, and chronic kidney disease. They help slow the progression of CKD by reducing intraglomerular pressure and proteinuria. Question 8. A patient with atrial fibrillation requires anticoagulation therapy to reduce the risk of stroke. However, they have a high risk of bleeding. Which of the following direct oral anticoagulants, DOACs, is associated with the lowest risk of bleeding? A. Dabigatran. B. Rivaroxaban. C. Apixaban. D. Edoxaban. Answer C. Apixaban. Explanation: among the DOACs, apixaban is associated with a lower risk of bleeding compared to the others, making it a preferred choice for patients with atrial fibrillation at high risk of bleeding. Question 9. In the acute management of a patient with ST segment elevation myocardial infarction, STEMI, what is the recommended reperfusion strategy if the patient presents within a timeframe suitable for both primary percutaneous coronary intervention, PCI, and fibrinolytic therapy? A. Primary PCI. B. Fibrinolytic therapy. C. Coronary artery bypass grafting, CABG. D. Medical management without intervention. Answer A. Primary PCI. Explanation: primary percutaneous coronary intervention, PCI, is the preferred reperfusion strategy for STEMI patients when it can be performed promptly. It offers better outcomes compared to fibrinolytic therapy. Question 10. A patient with heart failure is being managed with pharmacotherapy. Which class of medications is known to reduce morbidity and mortality in patients with heart failure with reduced ejection fraction, HFrEF? A. Diuretics. B. Calcium channel blockers. C. Angiotensin receptor blockers, ARBs. D. Angiotensin converting enzyme, ACE, inhibitors. Answer D. Angiotensin converting enzyme, ACE, inhibitors. Explanation: ACE inhibitors have been shown to reduce morbidity and mortality in patients with heart failure with reduced ejection fraction, HFrEF. They improve symptoms, reduce hospitalizations, and enhance survival in this patient population.